Have you ever received a devastating call claiming your routine cancer screening revealed that your cancer had returned and required immediate chemotherapy? Patricia Evans, a 74-year-old breast cancer survivor from Portland, Oregon, who had been cancer-free for 3 years, thought she was catching a recurrence early when oncologists called about urgent findings in her follow-up tests. Within 72 hours, she had paid $22,000 for fake cancer treatment that endangered her health with toxic substances. Patricia's story reveals how medical scammers target cancer survivors with recurrence fears, using their terror of cancer returning as the most powerful psychological weapon. By the end of this video, you'll understand exactly how these fake oncologists operate and learn the warning signs that could protect cancer survivors and their families. Stay until the end, because Patricia's experience shows how fake cancer recurrence treatments can cause actual health damage while stealing money, making these among the most heartless scams targeting vulnerable cancer survivors. The recurrence terror call. It was a Monday morning in January when Patricia's phone rang with a call that would shatter her hard-won peace of mind. She had just finished her morning meditation routine when her caller ID showed what appeared to be an oncology institute. Number: Mrs. Evans? This is Dr. Michael Thompson from the Advanced Cancer Surveillance Center. I'm calling about critical findings from your recent tumor marker screening that indicate your breast cancer has returned with aggressive characteristics requiring immediate oncological intervention. Patricia felt the world collapse around her. As a 3-year breast cancer survivor, the fear of recurrence haunted her daily thoughts. Dr. Thompson continued with impressive oncological authority and cancer terminology that triggered every nightmare she'd lived with since remission. Mrs. Evans, your CA27.29 and CEA tumor markers show significant elevation patterns indicating metastatic breast cancer with probable liver and bone involvement. Without immediate treatment, this recurrence will progress to terminal stages within weeks. The caller knew Patricia's cancer history, her specific tumor type, and even referenced her recent medical appointments. This personal medical knowledge made the recurrence diagnosis seem credible and absolutely devastating. I need to explain how urgent cancer recurrence treatment is for survivors like yourself. Secondary breast cancer typically progresses much faster than primary tumors, but we've caught this early enough for aggressive curative intervention. Building cancer recurrence terror. Dr. Thompson continued using sophisticated oncology terminology that Patricia recognized from her previous cancer treatment, making his claims seem both legitimate and terrifying. He described cancer progression and treatment protocols with medical expertise that seemed authentic. Your specific recurrence pattern shows classic signs of hormone-resistant metastatic disease with rapid cell division markers. The imaging patterns suggest micrometastases that require immediate systemic chemotherapy to prevent organ system failure. He explained that Patricia's survivor status made her particularly vulnerable to aggressive recurrences. Patricia had indeed been worried about every ache and pain, wondering if cancer was returning. Cancer survivors like yourself face unique challenges because recurrent tumors often develop resistance to previous treatments. Your cancer cells have learned to evade standard therapies, requiring specialized protocols designed specifically for recurrence patterns. Dr. Thompson created urgency by explaining that Patricia's medical knowledge made her understand cancer progression, and that immediate treatment was her only chance to survive this recurrence and maintain the life she had fought to regain. We need to begin emergency recurrence chemotherapy within 24 hours. This specialized treatment costs $22,000, but it's the only protocol that can eliminate the metastatic cells we're detecting before they establish resistant colonies. The survival protocol. Dr. Thompson explained that Patricia needed immediate chemotherapy specifically designed for her recurrence pattern. The specialized protocol would target the resistant cancer cells that had learned to evade her previous treatments. Emergency cancer recurrence therapy requires immediate payment because we must compound personalized chemotherapy drugs for your specific resistance markers. Standard insurance processing would delay treatment beyond the window when curative intervention remains possible. He provided Patricia with specific oncology codes and recurrence treatment authorization numbers that sounded official. Dr. Thompson seemed to have detailed knowledge of cancer protocols and spoke with authority about emergency oncological procedures. I understand this is devastating and expensive, but you fought cancer before and won. This recurrence is your cancer's last attempt to defeat you, and we have the weapons to eliminate it completely. Dr. Thompson created additional pressure by explaining that emergency oncology scheduling was extremely limited, and Patricia needed to secure treatment before other recurrence patients filled available chemotherapy slots. Based on your tumor marker velocity, we've reserved emergency treatment specifically for your case. Cancer recurrence doesn't follow convenient schedules, and curative intervention requires immediate action. The payment desperation. Patricia felt overwhelmed by cancer return terror and the pressure to fight for her life immediately. Dr. Thompson had created such convincing oncological urgency that questioning the treatment seemed like accepting cancer death. She agreed to the emergency chemotherapy. Dr. Thompson guided her through the payment process, explaining that the cancer treatment facility required wire transfer to secure her emergency intervention slot and begin drug preparation. Emergency cancer recurrence protocols require immediate wire transfer to guarantee specialized chemotherapy preparation and treatment room availability. This is standard procedure when survivor intervention is time-critical. At the wire transfer location, Patricia hesitated when asked about the payment purpose. Dr. Thompson, still on the phone, coached her to explain it was for emergency cancer treatment, which sounded medically urgent and legitimate. Patricia sent $22,000, believing she was fighting for her life again. Dr. Thompson assured her that treatment would begin within 12 hours and provided pre-chemotherapy instructions identical to those from her real cancer treatment. You've made a life-saving decision. This chemotherapy will eliminate the recurrent cancer cells and restore the remission you fought so hard to achieve. The dangerous cancer treatment. The address Dr. Thompson provided led Patricia to a converted medical building that appeared legitimate but lacked proper oncology equipment and sterile chemotherapy administration environments required for cancer treatment. The people claiming to be oncologists were not qualified cancer specialists. They administered intravenous substances through central line access that they claimed were personalized chemotherapy drugs designed for her specific recurrence pattern. The fake chemotherapy involved toxic chemicals that caused severe nausea, weakness, and symptoms worse than Patricia had experienced during her real cancer treatment. When she expressed concern, the fake oncologists claimed this intensity meant the drugs were effectively killing cancer cells. These severe side effects indicate the chemotherapy is successfully targeting your metastatic cells. Recurrence treatment requires more aggressive protocols than primary cancer therapy to overcome resistance mechanisms. After 12 hours of fake treatment, Patricia was severely ill with symptoms that seemed far beyond normal chemotherapy effects. Her condition was deteriorating rapidly, and she was experiencing neurological symptoms that had never occurred during legitimate treatment. The medical emergency. Patricia's condition became critical over the next 24 hours. She was experiencing severe dehydration, confusion, and organ system stress that indicated serious chemical poisoning rather than standard chemotherapy side effects. Her daughter became alarmed by Patricia's deteriorating condition and insisted on taking her to the emergency room. The oncologist there was immediately concerned by Patricia's symptoms and the story of unauthorized cancer treatment. Mrs. Evans, you've been given highly toxic substances that are causing multi-organ system failure. Whatever treatment you received was not legitimate chemotherapy, and these chemicals have caused dangerous poisoning that requires immediate intervention. The emergency team had to provide intensive supportive care to counteract the toxic effects and prevent organ damage. Patricia's condition was life-threatening due to the poisonous substances administered during fake treatment. Your recent cancer screening results were completely normal. There's no recurrence, no metastatic disease, and no indication for any cancer treatment. You've been the victim of a sophisticated medical scam that nearly killed you. The devastating truth comprehensive. Oncology evaluation confirmed that Patricia remained in complete remission with no signs of cancer recurrence. Her tumor markers were normal, imaging was clear, and there was no medical indication for any cancer treatment. The fake chemotherapy had caused severe chemical poisoning that required weeks of recovery and monitoring for permanent organ damage. Patricia's cancer-free status had been compromised only by the toxic substances administered by criminals. Her real oncologist was outraged that scammers had exploited her survivor fears to administer life-threatening chemicals, while claiming to provide cancer treatment. This is unconscionable evil. They used your legitimate fear of recurrence to poison you while stealing your money. Your cancer status remains excellent, but these criminals nearly killed you with their fake treatment. The investigation medical fraud investigators explained that Patricia had been targeted by a sophisticated operation that specifically focused on cancer survivors using their recurrence fears as manipulation tools. The investigation revealed that the same group had scammed dozens of cancer survivors using similar fake recurrence scenarios. They had stolen over $1.5 million while potentially causing permanent health damage through toxic fake treatments. Police discovered that the scammers used detailed cancer survivor databases, fake oncology credentials, and dangerous chemical substances designed to mimic chemotherapy effects while creating believable treatment experiences. Warning signs. Patricia missed. Looking back, Patricia identified several red flags she wished she had recognized. Unsolicited calls about cancer test results. She never authorized. Legitimate oncologists never call survivors about recurrence findings without established medical relationships and proper testing procedures. Immediate treatment demands with same-day payment requirements. Real cancer treatment is coordinated through established medical facilities with comprehensive evaluation and insurance verification. Pressure to begin chemotherapy without oncology consultation. Legitimate cancer specialists require extensive evaluation before starting treatment and encourage survivors to seek second opinions. Wire transfer requirements for cancer treatment. Established cancer centers process payments through normal medical billing and never require wire transfers for emergency treatments. The recovery journey. While Patricia never recovered her $22,000, her health gradually returned to normal as the toxic effects of the fake chemotherapy subsided. Her cancer remained in complete remission throughout the ordeal. Patricia's experience led to increased awareness about recurrence scams targeting cancer survivors in her community. She began working with cancer support organizations to educate other survivors about medical fraud, targeting their specific vulnerabilities. Most importantly, Patricia learned to verify all unexpected medical communications through her established oncology team before taking action regarding cancer concerns. Final thoughts. Patricia's story demonstrates that cancer recurrence scams are uniquely cruel because they exploit survivors' deepest fears while potentially causing life-threatening harm. These criminals understand that cancer survivors will do anything to prevent recurrence, including paying enormous sums for treatments that nearly killed her. The key lesson from Patricia's experience is this: legitimate cancer recurrence is never diagnosed through unsolicited phone calls demanding immediate payment. Real cancer surveillance is conducted through established oncology channels with proper documentation. If you receive calls about cancer recurrence or emergency cancer treatment, hang up and contact your established oncology team immediately. Never agree to cancer treatment based solely on phone calls, regardless of how medically urgent they sound. Remember, protecting your cancer-free status means working with qualified oncologists through legitimate medical channels, not paying scammers. who exploit recurrence fears to administer potentially fatal fake treatments. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.